You're live in the CNN newsroom. Thanks for staying with me. I'm Ana Cabrera in New York. Small but measurable progress in the fight against the coronavirus pandemic this weekend. It's giving Americans hope. Boy, do we need it. But it's also showing the need for everyone to stay cautious. First, here's the optimistic news. Round 3 of COVID relief checks are rolling out to millions of Americans as we speak. For those qualified, it is $1,400 per person. Many of these cash payments are expected to hit bank accounts this weekend. COVID vaccinations now at more than 101 million doses given to people in this country, according to the CDC. And about a third of those people are now fully vaccinated. Public health officials, though, are concerned when they see scenes like this. People packed close together, almost nobody with a mask, like at this restaurant in Miami Beach. It is spring break for a lot of people, and many are traveling despite advice against it. This is the packed beach. This is Miami Beach right now. Health officials insisting it is not the time to let down our guard. They are begging people to keep wearing masks and keep following safety guidelines. We have a team of reporters spread out across the country. CNN's Paul Verkaman is standing by for us out west in Los Angeles. But let's begin with CNN's Natasha Chen. She is in Miami Beach, where people, as we are showing you, are starting to flock for spring break, despite the warnings from health officials. And there has been an uptick in new COVID cases in Florida as well, Natasha. So are people there taking precautions?
Not really, Anna. When we were out at Miami Beach yesterday, not a lot of people wearing masks. You saw the restaurants pretty much packed. We're seeing this traffic behind us. The bridge is actually up so boats can pass through. A lot of the traffic is heading toward the beach right now. So a lot of interest in coming to beach locations for vacation, for spring break. And as I spoke to the Miami Beach Mayor Dan Gelber yesterday, he said it's really a struggle to keep people safe. Now, there is a curfew in place from midnight to 6 a.m. and there is a mask mandate, but there's no way under Florida law for him to actually fine anyone for not wearing a mask. Here's what he said.
I mean, the governor has made it difficult. We have a mask mandate. We just can't fine anybody, and we had given out 1,000 citations before the governor said he wouldn't allow us to. The really thing we're missing the most is, people will follow a culture of health and compliance if they hear a unanimity of voices telling them to.
And his struggle, he says, is that different leaders are giving people mixed messages about the approach for COVID restrictions. All he can do at this point is have people give out face masks on the beach to people, disposable ones, as well as these ones right here. Most people have been happily taking them, but he said some people react poorly to that, and he still gets daily emails from people upset at him about the mask mandate, Anna.
Natasha, it is such an easy way for us to do our part, is using these masks. Please stand by. I want to bring in Paul Verkaman, who has his mask on in Los Angeles. Paul, we know California is now adjusting statewide guidelines after reaching its goal of 2 million vaccine doses administered in the state's hardest hit areas. What more can you tell us?
Well, it's a more rosy picture here in California. And how did we get here to where we're closer to reopening movie theaters, museums, restaurants indoors, although at a limited basis? Well, an aggressive vaccination program. Behind me, this is the University of Southern California parking garage. Inside, they are vaccinating people from one of these hard-hit communities. They hope to vaccinate 1,000 people today. The goal is eventually 5,000. People are walking up. They're riding in the bus, they're driving through, and shots are going into arms. Tremendous excitement here for many people who are having a hard time finding a place to get that shot. And we talked to one man, he's a waiter at a cafe. He was thrilled. It was a double dip today. He got his vaccine, and tomorrow, because of the new rules, he's going to see more tips.
It was tough. It was tough because at the beginning we didn't know, we weren't sure if we were going to be surviving in all this time. There were moments that we didn't have a lot of customers coming in, so you get frustrated somehow. But right now, everything starts coming back with the vaccine and reopening. It feels more secure now.
And those restaurants, of course, a big part of California's massive tourism economy. Also out there, Stadiums will reopen. Baseball stadiums alone in California, almost 14 million people attended Major League Baseball games in the last year where there was a full season. And we can also tell you that theme parks are going to reopen. All of this is making for that what we described as a much rosier picture in California. Now back to you, Anna.
Oh, that sounds good. Paul Verkaman and Natasha Chen, thank you both. With us now, Dr. William Schaffner. He's a professor in the Division of Infectious Diseases at Vanderbilt University Medical Center. Dr. President Biden says he is instructing states to allow all adults to be eligible to receive COVID-19 vaccines by May 1st, and that he also has a goal of beginning to return to normalcy by July 4th. Is the U.S. on track to meet these two goals?
Well, Anna, it's a very ambitious set of goals. I think we're on track, but everything has to go smoothly. We still have to have a lot of vaccine come in, and the vaccinators have to make sure that vaccine gets into arms. And in the meantime, as you were saying in all those setup pieces, please keep wearing your mask. It's not, we can't declare victory yet. Not yet.
What about if you're outside, though? Because we showed those images of people at the beach, and it's hard to see just how close they really are together, given the science that we now know, and that those are less risky environments when you're outdoors because everything's super ventilated. Do you really need a mask when you're on the beach?
I think if you're separate from other people, you can do without the mask on the beach. It depends on how crowded those beaches are. And then, of course, you'll go from the beach right into a restaurant, right? Mm-hmm. And that's where the transmission risk goes up.
That's such an important point. And we know people are traveling, so they're mixing with more people who they haven't been around. The TSA screened more than 1.3 million people at airports on Friday, which is the highest number since March 15th of last year. When the CDC released its guidance on what vaccinated people can do, they didn't update their guidance on travel. Now, the CDC director says she's concerned about the variants coming through travel corridors. So that makes some sense. But was it a mistake for the CDC not to address this? Because now it clearly looks like people are just taking matters into their own hands.
Well, people and states have been taking matters in their own hands since the beginning of this COVID pandemic hit us in the United States. But I think the CDC is coming to us with a whole series of recommendations that will show us how we can gradually open up as we vaccinate more and more people. And travel recommendations will be among them, I'm sure.
Well, I'll be watching. New York announced this week, starting April 1st, out-of-state visitors will no longer have to automatically quarantine. Now, the New York City mayor called this reckless. What do you think?
You know, it's just what you can do. And people are being optimistic that this vaccination program will continue and more people will be vaccinated. So as that happens, the risk will go progressively down. It's not like flipping a light switch, but there isn't any doubt that if we can all continue to get vaccinated, the risk will diminish week by week.
How risky is it then to say you don't have to quarantine if you're coming into New York from out of state?
I actually think this virus is everywhere, and quarantining people who come into New York, I've never thought that was very effective, but that's just between you and me.
Okay, and everybody else who just heard you say that. But I think that's actually nice to hear for a lot of people, because that does give a sense of optimism, right? There's some interesting new research, and we're always trying to follow the science as we learn more and more about this mysterious virus. The New England Journal of Medicine this week showed that people who were previously infected with COVID-19 and got just one shot of the vaccine had antibody levels at or above those who had gotten both doses but had never been infected. So, doctor, is this an opportunity or an opening to rethink the double dosing strategy?
It is indeed, at least for people who have previously had documented COVID infection. And the Advisory Committee on Immunization Practices is looking into that, the CDC's group that makes recommendations about how vaccines ought to be used. So we may get recommendations along those lines sometime in the future.
That hasn't changed yet, though, so everybody should still be getting 2 doses right now. Is that what you would recommend?
Absolutely. At the moment, get your 2 doses. Can't hurt and likely will help.
2020 was America's deadliest year since 1900. And that, of course, was largely due to the coronavirus pandemic. And this is according to early data from the CDC. It shows 15% spike in the U.S. death rate last year. What does that mean for the nation's public health? What is this impact?
Well, Anna, for those of us who are public health people, an impact like that, showing an increase in the death rate, is just absolutely extraordinary. And I mean, to the folks who really think that COVID is just like the flu, that speaks against that. This is a huge influence on just the demographics of the United States. And we hope that the vaccination program will get us back to something more normal fairly quickly, certainly by the end of the year, I hope.
Yes, we all do. Thank you so much, Dr. William Schaffner. It's nice to see you. Thank you for all you do.
My pleasure, Anna.